All right, so Miss Lee, what are you going to do today then? You're going to talk about like what kind of human systems, anatomy and physiology of what system?
I'm going to talk about respiratory system and circulatory system.
Remember to talk also about diseases as well. Okay, like as much detail as you can possibly get. Okay, now you can start.
Okay, first I'm going to talk about respiratory system. The respiratory system is a vital system in the body responsible for exchange of gases between the body and the environment. It includes organs like nasal cavity,
Nasal, nasal,
nasal,
nasal cavity.
nasal cavity, pharynx, larynx, trachea or windpipe,
Mhm.
bronchi, and lungs.
Bronchi, bronchi.
Bronchi. The main function of the
Bronchi, and then
respiratory
finally, it's like the end of the bronchi. You can have something called the
alveoli.
alveoli. Alveolus is singular, alveoli plural. Okay, số nhiều mà.
Okay.
Just like single and plural.
Uh-huh. So the main function of the respiratory system is to bring oxygen into the body and remove carbon dioxide, which is a byproduct produced during cellular respiration.
Mhm.
Oxygen is essential for the body cells to produce energy, while carbon dioxide is toxic, so it must be removed.
Yes, exactly, because it can intoxicate the body if you don't remove it. If the concentration of CO2 is very high, obviously suffocation can happen. Okay, next please.
Now I'm going to talk about gas exchange. Gas exchange takes place in the lungs, specifically in
Specifically,
alveoli.
specifically in the alveoli, right?
Mhm. The alveoli has thin walls, so it allows oxygen from the air we breathe to diffuse into the bloodstream, where it is transported to the cells. At the same
Okay.
time,
But you
carbon
should also
dioxide.
mention, the fact, you should mention the fact that there are capillaries surrounding all of the bronchioles and alveoli, okay? You need to
Mm,
mention that fact first, so it will make sense about gas exchange, you know.
Okay,
Mình phải nói về cái cấu trúc của
so
mấy cái capillary nó bao phủ xung quanh tất cả mấy cái alveoli này thì sau đó mình nói cái vụ mà gas exchange á nó mới có nghĩa nha, tại
mhm.
vì yeah, you know what it is, you know.
Okay, so inside the lungs, the air will pass through a network of tubes called bronchial tubes, which branch out into smaller tubes called bronchioles. The bronchioles further divide and terminate in tiny air sacs called alveoli. Alveoli are the primary sites of gas exchange in the lungs. They're surrounded by a network of blood vessels called capillaries, which facilitate the exchange of oxygen and carbon dioxide. The walls of alveoli and capillaries are very thin, allowing for efficient diffusion of gases.
Okay.
Mm, Now, let's talk about gas exchange. So, gas exchange is partial pressure, which means and gases tends to move from areas of higher partial pressure to areas of lower partial pressure. So it means that oxygen from the air or water will tend to move into the organism's body, while carbon dioxide will tend to move out of organism's body into the surrounding environment.
Good.
So the oxygen from the air in the alveoli will diffuse across the capillary walls and binds to the hemoglobin molecules in blood cells. And the oxygen-rich blood is then transported to the heart and circulated throughout the body. At the
Okay,
same time,
how is the okay, my question is how is the oxygen traveling It's a gas, right? How is it possible that the oxygen as a gas moves to the heart? What carries that oxygen?
Blood. Blood carry the oxygen
No,
because
specifically, it has to be the hemoglobin molecules. Nó phải là cái phân tử hemoglobin á.
yeah.
I ever heard about it? Hemoglobin.
Uh-huh.
Don't tell me you haven't heard about it, okay?
Now I have heard about it. The oxygen bind to the hemoglobin to uh create to form oxyhemoglobin.
Of course, that's more like it. Good. There you go. So,
Okay.
the hemoglobin is part of a red blood cell, right?
Yeah.
So basically that's so when the red blood cell moves inside the bloodstream, it brings the oxygen back to wherever in the body, right? Including the heart.
Uh-huh.
Okay, that is a better way because it makes more sense. It's more
Yeah.
logical, you know.
Uh-huh.
Nó phải nghe có hợp lý logic hơn mới được nha.
Yeah.
All right, next.
Next. Next, I'm going to talk about the mechanics of breathing.
Breathing, 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 breathing.
Breathing. So the process of breathing starts with the contraction of the diaphragm, which is a dome-shaped muscle at the bottom of the lungs. When the diaphragm contracts, it moves downward, expanding the chest cavity. Simultaneously, the external intercostal muscle between the ribs contract, lifting the rib cage and further increasing the volume of the chest cavity. So this will decrease the pressure inside the chest cavity and creates a negative pressure, which draws air into the lungs through the nose or mouth. This is called inhalation. Now, after that, exhalate. It will occur exhalation. So during exhalation, the diaphragm and the external intercostal muscle relax, allowing the chest cavity to decrease in volume. This increase in pressure within the chest cavity forces air out of the lungs through the nose or mouth. Exhalation is a passive process. However, during forceful exhalation, such as during exercise or coughing, internal
In
external
the what?
the external intercostal muscle and the
Mm-hmm.
abdominal muscles contract to expel air more forcefully.
Mm-hmm. But you should also talk about like the diagram about like forceful exhalation, how many milligrams or milliliter, whatever, you know.
Okay. So now I'm going to talk about the lung volumes and capacity. So the
Mm-hmm.
tidal volume is the amount of air inhaled or exhaled during normal, quiet breathing. And it's usually around 500 milliliters.
Mm-hmm.
Inspiratory reserve volume is the amount of air that can be inhaled beyond the tidal volume, and it's usually about 3,000 milliliters. Expiratory reserve volume is the amount of air that can be exhaled during beyond the tidal volume, and
Mm-hmm.
usually around 1,100 milliliters. The residual volume is the amount of air that stays in the lungs after a person exhales as much as they can. It is important for keeping the lungs elastic and avoiding collapse of the alveoli.
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 It is around 1,200 milliliters. The vital capacity is the total amount of air that can be exhaled after a maximal inhalation. It equal to the sum of the tidal volume, the inspiratory reserve volume, and the expiratory reserve volume. It is around 4,800 milliliters.
But these numbers, does it depend on age? What do you think?
Yeah, it
Of course,
depends
it must
on
depend on age and sex as well. So these numbers are typically for about a male 80 kilograms, you know, 80
oh,
kilograms male. And it doesn't say that they are athlete or whatever. It's just a normal person, okay? Because
Uh-huh.
if you are working with, like, let's say a swimmer, an athlete, they have much more vital capacity
Mm-hmm.
because exercise helps you to have a more vital capacity so you can stay underwater for longer.
Oh,
So these numbers are basically not something you have to really
remember?
believe in those numbers, because
Ah, okay.
everyone's different. Remember that. Everyone's different.
Okay.
Okay, continue, please.
Next, we have the total lung capacity, which is the total volume of air that the lungs can hold and equal to the vital capacity plus the residual volume, and it's usually around 6,000 milliliters.
Mhm.
Also, we have the functional residual capacity, which is amount of air that remains in the lungs at the end of a normal passive exhalation. The
Mhm.
functional residual capacity is important to determine the
Determine,
amount of
determine.
determine
Những âm máy
determine
determine nhóm 2 nha.
determine the amount
Okay.
of air available for gas exchange in the lungs, and it can detect some respiratory disease such as the chronic obstructive pulmonary disease and asthma.
Mm-hmm.
The functional residual capacity is around 2 to 3 liters, but it can be affected by factors such as age, body position, and lung disease.
Mm-hmm.
Mm, So measuring these lung volumes and capacities are crucial because it helps us to detect some pulmonary disease, such as a decrease in vital capacity can be a sign of impaired lung function, while an increase in residual volume may indicate the presence of airway obstruction or other respiratory issues.
Mm-hmm.
Now I'm going to talk about some pulmonary disease.
Pulmonary disease
First,
are basically, there's a lot of
lung
pulmonary
disease.
disease. I think you should talk about like a respiratory disease. That's a better word. You bắt đầu
Respiratory disease.
respiratory diseases. The most likely is, of course, what's it called? Pneumonia, viêm phổi, or basically inflammation of the lung. Tuberculosis, but loud tuberculosis, and COPD, chronic obstructive pulmonary disease. Nó gọi là bệnh phổi thuyên tắc mà gọi là mãn tính á. Okay, and then asthma, of course, bệnh suyễn, and then all kind of diseases like viêm xoang là sinusitis is actually a disease of the respiratory system, very common in big city like Ho Chi Minh City. Almost everybody here has it to some degree, okay? They can be like really bad or medium or light. What's it called? Sinusitis. All right, please go on.
First, I'm going to talk about asthma. Asthma is a disease that have no cure. It is chronic disease, and it happens because the airway become narrows. So what triggers asthma? Some First, some common allergen like pollen, dust particles, feathers, or tobacco smoke, polluted air, or vigorously laughing, crying, or running. So what happens to an asthma patient? It happens when the immune system is hypersensitive. So immune cells respond, the immune response in the bronchial tube narrow down the bronchial muscle and the cartilaginous rings around them. So, wait a minute.
Yes.
So the mast cell of the mast cells in the immune cells, and when it contacts with the dust particle, it will burst and it will release toxins. And in that toxin, there is histamine. So histamines will make the smooth muscle to contract, and also it secretes a lot of mucus.
It secretes a lot of mucus, and what those mucus can do to the windpipe or to the respiratory tract then?
The respiratory tract become narrower, so there'll be less air that come through the airway, which
The
makes
airway.
the
Less
airway,
that come through the airway. Yeah.
the airway, which make the patients hard to breathe. So the symptoms of asthma are patients coughing, wheezing, chest tightness, or shortness of breath. So what
Just a moment, please. Just a moment, please. Okay. Okay, please continue now.
So what should the asthmatic patient do to relieve the symptoms? They could
Relieve, not release.
relieve
Khác nhau
the
nha. Relieve. Y kéo dài.
relieve,
To
relieve the
relieve.
symptom. They could use bronchodilators,
This one,
which
relieve the symptoms.
they
To
could use,
relieve.
they could use the bronchodilators,
Bronchioles, yeah.
which contain anti-inflammatory drugs, which reduce the inflammation. Or they can inject intravenous injections that contain medicine that rapidly reduce inflammation. But what the patients should do is they have to recognize the trigger, therefore try their best to avoid them. And they should also quit smoking and stay away from tobacco smoke, and should do deep breathing exercise. Next, I'm going to talk about a disease called emphysema. Emphysema is a chronic
Emphysema, phù phổi.
emphysema.
Yeah, emphysema.
Emphysema. Emphysema is a chronic disease and is not curable. Emphysema is when lungs lose the capacity to push air out, so they are permanently swelling because the air got trapped inside. The symptoms is protruded barrel-shaped chest. What are the causes of this disease? So 80% of the cases is caused by tobacco smoking. The rest is from chemical fumes and polluted air.
Yes, what else?
So to talk about how the tobacco smoke affect the alveolar, let's talk about the alveolar. So the alveolar has alveolar.
Alveoli or alveolar. Alveolar is the adjective form. Dạng tính từ của nó là alveolar or something.
Oh, I thought it's the plural form.
That's alveoli.
Alveoli, okay.
Nè, cái này là alveoli, sorry, it's supposed to be like alveoli is this one, plural form. The alveolus is basically the singular form. Okay, next one.
Okay. So the alveoli has a special protein called elastin, which helps it to have which help it to have the elasticity, which means that it can increase in volume and then return to normal
It just
state.
inflate and deflate. Nó thở phồng
Yeah,
ra hoặc là nó
inflate
xì
and
đi.
deflate.
Yeah. Inflate or deflate, yeah.
But when the tobacco smoke goes through the alveolar sac, it triggers the immune cells, and then the immune cell release chemicals that contain elastase. Elastase break down elastin, so it's mean that alveoli lose its elasticity.
Elasticity, yeah. Tính bà đàn hồi dẻo dai vậy đó.
Yeah,
Elasticity, yeah.
so therefore regular smoking will stimulate the immune system, making the immune system hyperactive. So what happens when the bronchial endings lose elasticity? It does not stay open, so which means that the air cannot escape. So next time inhalation, more air rush into the alveoli. That still contain air, so it's forcefully inflate and therefore destroy the alveoli.
And you don't want like fallen or basically what's it left? You don't want like a flat alveoli because a flat alveoli will not be able to perform its function anymore, right?
Yeah.
Nó không thực hiện được chức năng của nó nữa tại vì nó flat, nó dẹp lép rồi.
Mm.
And then that's why you need surfactant as well. Nó có cái hợp chất là surfactant đó, để mà làm tăng cái lực căng bề mặt á. To increase the surface tension, you have a substance called surfactant secreted by these cells in the alveoli. Did you write that?
No.
You should. Okay, please continue now.
Okay, so what are the treatment options for patient? First, the patient should quit smoking, and then the treatment options are oxygen therapy, lung volume reduction, or lung transplantation.
But lung transplantation would take a long, long time because to find a proper lung to transplant, it's a huge problem. The body will eventually try to reject the lung because it doesn't belong to that person, right? Cơ thể nó sẽ reject, nó sẽ loại thải ra, nó từ chối eventually. And it's very hard to find the proper donor. Khó kiếm cái người donor, cái người mà để cho phổi á. So right now we are having 3D printing technology, but it will take a while until we can print out like a heart, like a lung, or something like that. That is cheap, you know.
Yeah.
It's still very expensive. It will take some time for it to become less expensive. Okay, please continue.
There are preventions that we can do to like wear masks to avoid breathing polluted air or stay away from tobacco smoke and quit smoking. That's it.
Are you sure that's it?
Yes.
Okay, so my question for you is, what are the sinuses for? Mấy cái xoang để làm gì? So the sinuses we have in this picture, you can see here frontal sinus, xoang trước. When you have sinusitis, the frontal sinus can hurt so much. It hurts and you have headache. Ugh. And basically there's some other sinuses. There are about 4 different sinuses here. Sphenoid sinus, cái chỗ mà sinus ở cái xương bướm á. A sphenoid bone actually looks like a butterfly. That's why it's called sphenoid. And you have sinuses here. Basically, the scientists are yet to discover the function of the sinuses, but when they get inflamed, you're in trouble. You need treatment. You need like medicine, like antibiotics to treat it. Người ta chưa tìm được cái chức năng mấy sinus này đâu, chưa hiểu được. Nhưng mà khi mà nó viêm thì là biết ngay. And then my question for you is why is the respiratory system vital? And what are the common diseases with these, for example, trachea, pharynx, and epiglottis problems? What are the common problems with that? Do you need time for it?
Yeah, I need time for it.
What?
Can I have some time to prepare?
Okay. Okay,
No,
you can talk
not
about it
yet.
now.
Not yet.
What's that? Not yet? Really?
Yeah, yeah, not yet.
You can talk about it now.
There are some respiratory disease that I want to discuss is
Say
the
what?
and now I'm going to talk about some respiratory disease.
Mm-hmm.
For the nose and the sinuses, uh, there is sinusitis.
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 Sinusitis. Sinusitis.
Sinusitis. It is one of the most chronic conditions. The symptoms is nasal obstruction, nasal drainage, decreased sense of smell, facial pressure, and frequent sinus infections. Treatment include medications that have anti-inflammatory nasal sprays,
Mm-hmm.
oral inflammatory inhibitors, and systemic steroid medication or endoscopic sinus surgery.
You understand? Do you even understand like these? Do you even understand these words?
Yeah, a little bit.
Okay, so endoscopy means like you have to put like a whole tube inside your body. That tube will basically has a camera, so
Uh-huh.
so the doctor can see what's inside. Nội soi, yeah.
Okay.
Endoscopy, and of course you need like systemic what's it called, steroid,
Yeah.
like glucocorticoids in order to reduce the immune system. Cái systemic là theo hệ thống, mình giống kiểu mà bỏ vô trong đường máu á. Like
Oh.
IV, systemic means like IV intravenous injections. And glucocorticoids or just corticoid or steroids are used to suppress the immune system. Nó giống như là nó làm chặn đứng, nó làm yếu đi hệ miễn nhiễm để mà cơ thể đừng có phản ứng lại quá nhiều quá. So that the body doesn't react too much and cause even more mucus or something. Because sometimes the reactions, the what's it called, allergy can be deadly, you know that, right?
Yeah.
Dị ứng có thể gây chết người, phải không đâu, do là phản ứng quá nhiều á. Okay, what else then?
Next, there is nasal and sinus polyps. The nasal polyps are associated with the sinusitis.
Sinusitis.
And occur when the lining of the sinuses swell.
Mm-hmm.
So the polyps block the nasal airway, creating difficulty in breathing.
Mm-hmm.
Next, I will talk about disease of the pharynx. There is pharyngitis. It's the inflammation of the pharynx, which often referred as sore throat. The symptoms is scratchiness in the throat and difficulty swallowing.
Mm-hmm.
Next, there's a disease about the larynx, that is the laryngitis. The symptoms is change of voice, fever, difficulty in swallowing, and sore throat occur in severe infections. The cause of this is viral infection of the upper airway, such as the common cold. Next disease about trachea is the tracheostenosis, a narrowing of the trachea that prevents lungs from receiving air that they need,
Mm-hmm.
or tracheomalacia. which is the disease that it breaks down the cartilage in the trachea, causing the structural of the trachea become compromised.
Okay,
That's
good.
it.
Now, what else can you mention? Of course,
That's
if you don't breathe for like a few minutes, your whole body will start to die because of lack of oxygen. So
mm-hmm.
they say that the breathing system or the respiratory system is the way to life, con đường sự sống á. Because within a few minutes, if you don't breathe, it's your brain that start to die first, and then your heart, and then the rest of the body dies. But first is the brain, because the brain need a lot of oxygen too.
Yeah.
And the thing that moves quickly, all the muscle will die. The first thing that die is the heart. But I think the first thing is the heart and the brain first. And then the other things. Nói chung cái nào nó hoạt động dựa vào nhiều oxygen mà rơi vào tình trạng thiếu oxy nó sẽ chết trước. Okay, you have to understand those things. All right. What else can you mention about the respiratory system?
Nothing else.
Okay, think about the fact that the trachea, think about the fact that the diaphragm, this is a huge muscles that are responsible for breathing in and out, right?
Yeah.
So you said that when a diaphragm contract, what happens?
When it contracts, it moves downward so that it increases the chest cavity.
It increases the pressure. It decreases the pressure actually.
Yeah.
Causing
Increase
the
volume.
air, causing the air from outside to get into the lung, right?
Yeah.
Khi mà cái diaphragm nó contract á, nó kéo xuống, nó làm cho cái áp lực bên trong cái lòng phổi nó giảm xuống mạnh, thì là áp lực không khí bên ngoài á, nó cao hơn, cho nên là không khí bên ngoài chui vô phổi. And when diaphragm relaxes, it pushes the lung upward, right? Nó
Yeah.
đẩy cái phổi lên bên trên, and it causes increase in pressure inside the lung, right?
Yeah.
And pushes the air out. Okay, great. So there are some diseases that can affect the muscles, some kind of genetic disease. There are a lot of genetic disease that can affect the muscle, you know that, right?
No.
Rất nhiều cái bệnh về di truyền có thể ảnh hưởng đến cái cơ bắp nha. And the diaphragm is actually a kind of muscle. So kiếm cái bệnh này nè. Look for this disease. It's called Duchenne muscular dystrophy.
Oh.
It's a genetic disease that will result in a very slow but deadly condition. It kills off your muscle slowly. Look at this one. Duchenne muscular dystrophy. So what will happen here? Eventually, your muscle die slowly. So it decreases heart function, giảm chức năng tim. Cardiomyopathy, myo mean muscle, cardio mean heart. So basically, it's weakening of the muscle of the heart. Sự làm yếu đi của cơ của tim. And heart failure dẫn đến sự suy tim. And then weak diaphragm, you see, nó làm cho cái diaphragm nó bị yếu đi nè, cái cơ hoành yếu đi nè. And of course, what does it have? What will happen? Respiratory failure, suy hô hấp. And of course, you have a loss of muscle mass. Cái lượng mà cơ của mình từ từ nó giảm dần. And inflammation happens and fibrosis, viêm nhiễm và nó xơ hóa. And then you cannot walk anymore. You require wheelchairs. Còn lúc đó là cần phải đi xe lăn á. And I think they have found a drugs against it, I think. Advanced treatment for rare diseases. I think they have found a drug against this one already. I'm not so sure. But it is a genetic disease. You will surely learn about it, okay?
Okay.
Okay, what else then? So imagine when the diaphragm is weakened because of these diseases, the person cannot breathe in and out effectively anymore. Respiratory failure happen. Suy hô hấp diễn ra. What happened next?
We
Of course, they will
die.
eventually die because they are getting weaker and weaker and weaker, and they eventually die, you know.
Uh-huh.
Very, very bad. I mean, in the past, if you get those diseases, people will say that you will eventually die, so they will ask the family to euthanize you or put you in a good death. They will inject a poison to you so you die quickly. So you don't have
Ờ,
to suffer anymore. Nó gọi là an tử, chích thuốc độc,
ờ.
chích thuốc độc cho nên chết luôn ngay lập tức khắc khỏi phải đau đớn.
Cái đó là chích cái
Um,
gì vô vậy thầy?
well, normally I think so. I think I'm not so sure. Let's say euthanasia nó gọi là an tử. Eu là good nè, thanasia, thanas là cái chết nè, cái chết tốt nè. Good death,
Ờ,
euthanasia drug.
là chích cái đó
Um,
vô mình không đau mình chết luôn đúng không thầy?
of course.
Ồ.
Well, some of these drugs are used. You can say assisted dying. Yes. What kind of drugs here? Let's see. There are some field drugs that are used. You can look at this one. Utasol, dung dịch để chết. Utasol. Was it inside? It's for dogs only, I think. Oh, it's for killing dogs. But for
Ờ.
human, I think we can use phenobarbital. It used to be used for sleeping, inducing sleeping, thuốc ngủ. But if you increase the dose, like if you inject too much, it will lead to like the nervous system failure, or you will never wake up. Okay,
Ờ.
không bao giờ, nếu mà chích quá liều là không bao giờ có thể tỉnh lại được nữa. Oh well, that's euthanasia. And then what else? You have other kind of drugs, I think, but mostly for dogs because they suffer from a lot of diseases too, you know. Dogs and cats.
Ồ quá. Cua đêm.
A lot of diseases of dogs and cats, we have no drugs yet, okay?
Ồ.
So it's a very bad situation. Okay, letabarb euthanasia injection, you can see here. Not for use as an anesthetic, không để sử dụng như là một thuốc mê. Nó chỉ dùng để an tử thôi, for euthanasia only. Active constituent, let's see. Phenobarbital sodium. Nó giống cái thuốc gì? Cái thuốc ngủ á. It's a kind of sleep inducing agent. Well, maybe yeah, these things will kill you. Let's look at the drugs for what's it called? Lethal injection. Tử hình bằng cách mà chích thuốc độc á.
Ừ.
Drug for lethal injections, actually potassium chloride,
Ủa.
KCl. Potassium chloride, what is it for? To stop the heart. Because you know about action potential, right? Em biết về cái điện thế hoạt động chứ.
Dạ không.
Okay, basically, sodium will cause the muscle to contract. Nếu mà
Ừ.
natri nó cho là cái cơ bắp nó sẽ um, co lại. But potassium will cause the muscle to stop contracting. K cộng sẽ làm điều ngược lại. Nó làm cho cái action potential điện thế hoạt động nó ngừng. So
Ừ.
potassium chloride will cause the heart to stop beating, okay? Đầu tiên là ngưng tim đã. And but when this muscle, when the heart stop, you still have all the muscles in the body, okay? Vẫn còn nhiều cơ
Ok.
cơ thể khác. But to paralyze the muscle, we use vecuronium bromide and midazolam. This is to sedate, to make the person fall to sleep, okay? Chất gây
Ừ.
mê để cho không cựa quậy được. So the person cannot react. But basically, these drugs kill you within half an hour to an hour, okay? You still
Ừ.
experience a lot of pain, but because of midazolam, you cannot react, okay?
That's scary. Sao
Of
người ta
course,
không chích cái midazolam trước
lethal
vậy?
injection does not kill you immediately. It kills you after like half an hour to an hour. Nửa tiếng đồng hồ đến 1 tiếng đồng hồ chịu đựng chết. Mm-hmm. So it is not that. So basically, it is not very humane in that way. It still causes a lot of suffering. Vẫn gây ra cực
Yeah.
rất nhiều thứ. Well, you know, humans are weird. And these are the place where people will do little injections. Look like a hospital, right?
Yeah.
But still, it's still better than pháp trường. It's still better than like the shooting range, you know.
Yeah, yeah, yeah.
Still better than shooting range and shooting
Oh,
at people.
scary.
Or there's a gallows. You don't know what it is.
No.
Gallows is these things.
Oh.
Yeah, go. Well, gallows is still a way basically were used a lot in the past to kill people. Yeah.
Mm.
And so basically the person being hanged, they don't die immediately. They die slowly within like 1 or 2 minutes, okay?
Oh.
And another thing that will kill you, but it's more spectacular, nó ngoạn mục hơn, một cái nữa nó ngoạn mục hơn đó chính là cái gì? The guillotine. The guillotine is basically this one, guillotine. Máy chém. The
Oh.
guillotine is basically used to chop the head out of a person. So of course the head will die within like 1 or 2 minutes because of lack of blood and oxygen, okay?
Yeah.
But it severed your brain, your head from your spinal cord. Nó cắt cái đầu ra khỏi cái cột sống rồi. So basically you're dead. But your head is still alive for 1 or 2 minutes, okay?
Oh.
And there's another one I want to show you. That is the electric chair. Ghế điện. The electric chair will kill people because of electricity, of course. And
Mm-hmm.
then they die within like, I think, less than a minute, I think.
Oh.
And you know the electric chair was invented by a dentist, right? Vừa được phát minh bởi một nha sĩ.
Oh my God,
Anyway,
dentists are scary.
I think that's a lot of details already. And right. So my question for you about the lung basically is if you lose one lung due to like some kind of diseases or problems, you still have one lung left, right?
Yeah.
So you can still be alive, right?
Yeah.
True, but you cannot do like a strenuous work like before because when you do strenuous workout, both of your lungs need to work, you know?
Mm-hmm.
I see. Okay, I think that's it for today.